In April 2020, as the Covid-19 pandemic spread, 1 in 5 people in South Africa were going to bed hungry. The lockdown left millions of casual workers unemployed, and the existing system of food parcel distribution was overwhelmed. The severity of the crisis called for an immediate and decisive policy response. Welfare support in low-income countries often comes in the form of food parcels. Some policymakers worry that providing cash as welfare support, instead, might encourage spending on non-essential items instead of necessities like food. But rigorous impact evaluations over the past decade have shown that giving cash directly to households without any restrictions can actually be more effective in improving people's welfare. Before the pandemic, a team of researchers, including JPAL affiliate Kate Orkin, tested this approach in a 1.5-year study across 415 villages in Kenya, involving over 8,000 participants. The results challenged traditional assumptions and offered compelling evidence for the effectiveness of direct cash support, also known as cash transfers. Evidence from the study revealed that recipients used the money to buy nutritious food, expand their businesses, and increase their income. Contrary to some policymakers' fears, the transfers didn't discourage work, but rather led to increased productivity. These results were consistent with findings from similar studies from other JPAL researchers. Drawing on their collective expertise and these findings from Kenya, the research team collaborated with South African government agencies to apply learnings to the COVID crisis. They advocated for a bold shift in welfare policy, transitioning from food parcels to cash transfers. Their recommendations informed a rapid policy response.
After these changes, within a few months, 28 million people were receiving emergency cash grants. An independent study found that these transfers kept 5.5 million people out of extreme poverty during the first lockdown.
The team's collaborative efforts contributed to South Africa implementing one of its most significant welfare reforms in decades. By extending cash grants to unemployed individuals, the government not only lifted millions out of poverty, but also empowered recipients to make decisions that worked for them. The team's findings have shown that cash transfers are not just an emergency measure, but a potentially scalable approach that, in many contexts, has shown promise transforming social welfare in low and middle income countries.